So the key unmet needs in atrial fibrillation at the moment are three things. The first is the huge volume of patients that are suffering from atrial fibrillation and giving them access to appropriate therapy. Secondly, we need to know how best to give them that therapy. What role do drugs play? What role does ablation play? And while scientific evidence is building up, we still have some unanswered questions, particularly in patients who have persistent AF. And the third unmet need is an answer to the question, does AF ablation and AF therapy reduce risk of stroke? So invasive approaches to AF management can be particularly useful in patients who don't want to take antiarrhythmic drugs. For example, young patients who the idea of taking regular medication is not attractive to them at all. In patients who can't tolerate drugs because of other risks, for example ischemic heart disease, and in patients in whom drugs haven't been successful in suppressing their symptoms. So the lab team can help with improving AF ablation outcomes because technology has now become pretty stable. There aren't many progresses in AF ablation technologies. So now focusing on the procedure and on the process, making it as efficient and safe as possible for the patient has huge impact on their outcomes. And that's a process that it doesn't revolve around the operator, it involves around the whole lab team and the institution. So getting them to work together as a team to work really efficiently can have a big impact on the success rates and the procedure times. So the big advances in AF management, I think, over the next 5 to 10 years will be more focused around patient selection, identifying those patients that are most likely to respond to AF treatment, and then making that treatment as efficient and safe as possible. I think technology is going to deliver less and less to us over the next 10 years until we really understand the mechanisms of why some patients get AF and some patients don't, and how persistent AF manages to sustain itself. And until those questions are answered, I think we're focusing on process and procedural dynamics.